The Mohawk Valley Health System is pleased to present the exterior design of its new hospital, which will be the center of its integrated healthcare campus in downtown Utica. Presented by Ryan Hullinger with the architectural firm NBBJ.
We're going to be focusing on the exterior design of the project and why we've designed it the way we have. We're going to talk about a general project introduction, a timeline that goes through the major project milestones. We'll talk about the collaborative process and all the community input that we've received, and then actual site planning, and then finally that exterior design. So here is a timeline showing those major project milestones. Basically, this project began in 2014. Mohawk Valley announced that it was exploring opportunities to fund and build this hospital for the community. And then this zone right here is all about the state funding that became a very important part of this process. $700 million that were going from the state, and then more specifically, $300 million of that tied into this hospital project. So that was April of 2015. Then as we move into 2016, this was all about the application process for that state funding. Moving into something a little closer to the present, we have a couple more bullets that were tied into the funding and the way that's being tracked. But here is where the architecture and design team really came on board. This was the middle of 2017. Here, the certificate of need to the state was submitted, and then that CON was approved in April of 2018. As we've continued to move forward into the present, the seeker draft environmental impact was just submitted in October. And then we move forward into the future where we have the start of hospital construction happening in September of 2019, and then the end of construction in December of 2022. Here we'll talk a little bit about the collaborative process for the project. So this is the vision statement. It's a vision statement that we're all very proud of because it really hits on three big areas. We want to create this advanced healthcare campus for these three groups. One, we want to promote the health of patients. That's the thousands of patients who are going to be visiting every year, thinking about them as individuals and then also with their families. But then also we want to think about the caregivers for this project. So essentially, 4,000 people working in this hospital, all working to provide care for these patients. We're optimizing the work environment for them, knowing that they're spending 8 to 12 hours a day. And if we can improve their well-being through architecture, we can improve the care that they provide. And then lastly, really scaling up beyond just the patients and families and the caregivers, it's the city of Utica and even the region. And the project has this amazing opportunity to be a catalyst for the revitalization of downtown Utica. This is about the metrics that are tied into all those community meetings. So basically over 100 community meetings that happened about a year and a half ago. Some of those meetings were 2 or 3 people, some of them were hundreds of people. But in all, over 2,000 people involved in those interactions, gathering input from them, learning about their hopes and dreams for this project, and working to ensure that what we were doing was aligned with what they wanted to have accomplished. That was external, and then internally, over 175 user group meetings. So this was within Mohawk, and basically in those 175 meetings, over 400 Mohawk Valley staff involved, and those were physicians, clinicians, non-clinical staff, technicians, and staff support. So of course we have doctors and nurses very engaged in the process, but also people from security, environmental services, transport. We're bringing all those people to the table so that we have a clear understanding of what this building needs to accomplish. And way before we're thinking about architecture and bricks and mortar and the size of rooms, we're thinking about the processes in the hospital. We want to make sure that the hospital is built around a set of processes that are optimized and streamlined for the future of healthcare. The container is going to be shaped by the things that go on inside it, and as much as we can do to add efficiency to those processes, that will all contribute to efficiency for the architecture. And then we moved on to a set of meetings that was about program adjacencies. And really in those, we were focused on working with the user groups and the hospital leadership to understand what departments needed to be next to each other in order to simplify the way things and people move throughout the building. And the more that we can locate directly adjacent from one department to another, the more we can add efficiency and again, make for a more compact and streamlined building. Then we moved on to these meetings. These were departmental flows. This was great because you have a series of nurses in the room, and they're actually then digging into a single department and building a cardboard model of the way that department would be laid out. So there are hot glue guns, they're cutting out cardboard, and they're actually interacting with that model and then working through different options and then talking through the pros and cons of each. It's very hands-on. It's much better than looking at PowerPoint drawings on a screen. It's actually engaging a different part of your brain when you're building something. So we get great feedback from these kinds of sessions. The next event is actually building physical mock-ups of the space. So here you see these large sheets of cardboard. This was all done in a warehouse space. And essentially with that, we're building the key building blocks for the hospital. So this would be a typical patient room. We also did one for an ICU room, typical exam rooms, operating rooms, and ED treatment rooms. So for each of those, we're building a full-scale space so that the staff can interact in that space and, again, reconfigure it and talk about the different pros and cons. The nice thing about this is nothing's really left to the imagination. You can bring in a real bed, real equipment, and you can study different scenarios in that space in a way that you never could if you were just working in a drawing. And since then, we've actually moved from a mock-up approach that's not just based on the rough cardboard that can be reconfigured, but a more refined version where we're building the mock-ups in a different warehouse, and in this case, out of metal studs and sheetrock. So this is getting much more detailed. We're bringing in all of the real equipment, beginning to locate the outlets on the walls, and then even bringing in the lights and booms in this OR space so that everything can be tested in real time. This is a list of the team that's been involved to date. The nice thing about this group is that it combines people who work on architecture and healthcare all around the world to people who are very locally specific. So again, we're getting great ideas in terms of global innovation and then a local understanding after years of working with the hospital at the local level. That was internal. Now this is more external and the community input that we've received from all the meetings that have happened over the last 2 years. So here are some of the things that we heard, and in each case we tried to listen to these and then steer the design in a direction that serves these precepts. So augmenting the vibrancy of the city, encouraging business, designing for all 4 seasons, promoting a parking plan. That's a really important one. Parking is incredibly important to the design of effective healthcare facilities. You have people often with limited mobility, and they're often very stressed when they're coming to the hospital. So making a parking plan that's very clear, very legible, and provides parking quite close to the hospital is very important. What we did in this project was respect the existing street grid. So we closed as few streets as possible and allowed them to continue through so it works within the existing conditions of Utica and really honors that existing urban fabric. Benefiting Utica's skyline, that was another one that was really important. How does the building fit within the skyline? What is the materiality of the building and the size of the building so that even though it's large, it doesn't overpower what's already here, but really complements the existing city skyline. And then lastly, connecting neighborhoods rather than being a barrier. Designing for views, that was really important. Thinking about the shape of the building so that you didn't have rooms that were looking into other rooms, but they always had views either to the city skyline to the south or to the hills to the north. And then supporting urban growth that fits right into that vision statement that's about this building acting as a catalyst for the revitalization of Utica. All of those things led to a site planning exercise that works to understand how this building fits into its site. So we'll talk about this on a couple of levels. The first point is the building shape itself. Basically, the large white rectangle here is a 2-story base. That has things in it like the emergency department, surgery, the main entry, administration, imaging. And then above that base, you have a bed tower that's more slender, and that has inpatient beds rising above that base. And that's the S shape that I'm tracing here. In terms of how you arrive at the site, this is Lafayette, Oriskany, and Columbia Street. So you come in on Lafayette, and you have a drop-off loop for the main entry, and then that also continues over on Cornelia and out to Oriskany. The nice thing about the location of the parking garage here is that on your way in, you have a direct line of sight to that parking garage. so that after you drop someone off, you know exactly how to get to parking, and then you can walk across and get right to the front door. Then likewise, the emergency department drop-off happens over here. In this case, we've been able to separate all emergency department drop-offs from that main entry. You do those entrances at opposite sides of the campus. Again, real clarity so that people know how to get to one place or another. And likewise, they come in, drive right by the garage, and so they know right where that garage is and have a short path into the main entry after they've parked their cars. So those are the two key points for public entrance, a main and emergency department. The ambulances enter the emergency department over on this end through a dedicated drop-off that happens on Columbia Street. So in this case, ambulances pull in, and there's coverage for 6 ambulances to stop here, unload their patients, and then loop around. We know that with events at the odd, you can have some congestion on the north side of the site. So it was important to move the ambulance entry as far away from that as possible so that ambulances are never encumbered by that congestion. That's a good reason to have it along Columbia Street. The other thing that's happening along Columbia is a potential medical office building here, and we're also considering a potential office building that's located on this spot right here along Lafayette. There's a CUP, that stands for Central Utility Plant, that has the boilers, emergency generators, heating and air conditioning equipment. That's all located here, and there's a second-story bridge that crosses over Columbia that ties into the building at this point. And then a small service yard that happens here with a brick screen wall that screens that. A couple of other things about the site planning. It's always important to think about what's next in terms of growth and expansion for a hospital. And the two departments that are most likely to grow or expand are emergency and surgery. And so we've located those two departments at this end of the building, emergency on the first floor, as I mentioned before, and surgery on the second, so that when those two departments need to expand, they have this green space to expand out onto, and they can basically double in size by reducing the green space over here and then reworking the drop-offs at this end. And then the last thing we'll say about the site plan is that everything vehicular happens along Lafayette right to this point at the main entrance, but then the car traffic is stopped. Lafayette continues as a pedestrian-only route all the way from Cornelia over to State Street. And we really think there's a lot of potential in that space between the garage and the building for a park-like setting that really connects the building to nature and allows for people to park in the garage, come over to the main entrance, or park in the garage and come over to the emergency department without crossing any vehicular traffic. So an improvement for safety from everyone who's moving back and forth between the building and the garage. That park-like setting is a big driver for some of the images we'll show in a moment. Also on the site plan, you see this ring around the edge. From the outside of that ring to the main entrance is a 5-minute walk. We put this in response to what we heard from the community about the need for that pedestrian-driven design. And so this gives you an idea of how well this main entrance connects to all the things that are happening downtown. So for instance, here's the Hotel Utica, here's all the redevelopment on Genesee Street, and this gives you a good idea of how easy it will be for staff to take a break, lunch break, and walk out and eat in these restaurants and the new services that can be developed in downtown Utica. It also gives you an idea of how close the project is to Varick Street and the way it can be supportive of all the new activity that's happening over there. And of course the odd and all of this activity is then well within range as well. This then is that bigger picture. It shows how our project fits into all the new activity that's happening around it. And it's so interesting that this activity is really a wheel with this as the hub. It's so central and it can be this economic driver that benefits all of these other neighborhoods and is really only a few minutes away from each. So here's a little bit about the exterior design process. Once that site and general shape of the building was worked out, we could then focus on this exterior. And essentially with this, we're looking at two different options. This one has a more horizontal orientation for the windows. This has a more vertical orientation for the windows. It's how these buildings are going to tie into the Utica skyline. It's important, though, to not only focus on them from this one perspective, but to always be thinking about the options at a different scale. So you start off with the big picture. At the same time, though, we're thinking about how this looks when you walk right up to it. In fact, that's a person inside the window. And then zooming in even more, what it's like to be in a patient room. Here's the bed, the door, and a person, and experience these two different ways of doing an exterior design. So in this case, this more vertical orientation led to an interior experience with glass that was floor to ceiling, but not wall to wall. In this case, exactly the same amount of glass, but not floor to ceiling, and in this case, wall to wall. And we talked a lot about all the pros and cons for these two options at all of these scales. How it would look on the skyline, how it would look at an intermediate scale, and then what it would be like to be in the room. And interestingly, this was definitely preferred as an experience for the patient and for the families in the room. And this also had a significant energy savings. It was going to save the hospital about $200,000 a year in energy cost. Same amount of glass, but because of the difference in configuration, was going to require less energy and would be more sustainable. So that was a huge plus for this particular design. And ultimately, that decision was made not just looking at these things in drawing and not just building them in the mock-up, but looking at them with a virtual reality kit that allowed, in this case, the board of directors to study each option here with the headset on and the joysticks so that they could move around and move within the building and really understand what's beneficial about each of the options. And that really led us to an understanding of this being the approach that we wanted to use moving forward. But we needed to move on and really focus on what the material is for that once we understood that texture. And here we go with a series of materials that were all studied. Obviously, brick was a given as an option because of all the amazing brick buildings here in Utica. But we're also looking at other building systems, all high performing, and the way they look and the way they feel. We also did a careful study for each of their performance. We talked about how they compare in terms of cost and weight. Then we also talked about them in terms of how well do they keep water out of the building, how well do they insulate, and what's the warranty for each. Again, very important for a hospital that's focused on this building, not just in terms of day one cost, but how much it will cost to operate it for 50 years. And also tied into that is a study of maintenance for each. What's the cleaning protocol, and how often do you have to repair and replace it? It's long-term thinking about all these different building systems and which is most appropriate for this hospital. So this is our site right in here. And of course, with this, we can go back in time and we can think about all the amazing architecture that's been a part of the history of Utica. We love this photo because you see all of these old buildings. And what's terrific about our site is that many of these buildings are still nearby, these architectural gems in brick, very ornate and detailed, and this expression of craftsmanship. But then also, what is terrific about this site is that just a few miles away, you have the things that are going on at Polytech, and a very different look for the architecture there. You know, it wouldn't make sense to wrap a nanotechnology R&D facility in something that looks this old-fashioned. These buildings want to have an expression of something that's more cutting edge, and we're really sensitive to that, and we're thinking about the balance between those two, the balance between the old and the new. So essentially, what we're working to do is honoring Utica's rich history, and then likewise embracing this innovation-driven future. So it's really like these two things, the historical and the contemporary. They can be thought of as exclusive and separated, and what we're working to do on this project is to combine them, to find that space in the middle so we achieve this goal. And essentially with that, on the exterior, we want to respect the history of Utica and at the same time do something that projects a sense of clinical excellence for this hospital. That's really the key, so that when you walk up to the building, you understand that state-of-the-art care is happening on the inside, and the exterior is messaging that to you as you approach it. We spent a lot of time studying the buildings of downtown Utica, and we've picked this building, Hotel Utica, because it's emblematic of a lot of the other great architecture in town. We've learned a lot from this building, partially by looking at the outside, but actually through our design team staying at this hotel through all of our visits to Utica. And that was terrific for us because when you actually stay in the hotel, which is directly adjacent to the site, you have the opportunity in the morning to open up your windows and then look out at the site itself. You can see the way the sun moves across the site from morning to evening, the way the seasons change on the site, or even at the end of a long day, just going out and walking the site, understanding its real texture and the nuances of the site. It became so apparent because we were basically living there right next to it and right on the site. But the other thing we did with this building was not just live in it, but actually study it architecturally. So the next few slides begin to dissect it and think about an analysis of this building and the other buildings in Utica that we can use to learn about how to make our building, our new project, fit into Utica more successfully. So essentially with this building, you have this very clear delineation between the base, the middle, and the top. And there's a logic behind that. You can ask, well, why did they make that distinction? And essentially, there's a zoning that's actually tied into usage. So at the base, you have this commercial zone. It has public programs like the ballroom, the main entrance, the restaurant and bar now. And that public program then is served by these large vertical windows. It has a civic scale to it, and it engages the streetscape. Then the zone up above is the guest room zone. Here, it's a more private sensibility. So you have private programs, smaller openings that feel more scaled to the individual rather than the civic scale. So it's domestic, and it engages the skyline. And then not only that in terms of proportions and texture, but there's a real material logic to this design. The heaviest material, and when this was built, the hardest material to move around was stone. So they allocated that at the base, and then they used lighter materials, the brick, as they went up above that. Our project, likewise, has these two essential zones. We have the base, the two-story base, and then the bed tower rising up above that. And on top of this, we can overlay exactly the same bullets that we were using with Hotel Utica. At the base, you have public programs, large vertical windows. It has a civic scale and engages the streetscape. And then up above, something that feels more private. The private programs, the personal scale, and it engages the skyline. And then we also borrow that material logic. In this case, brick is the heaviest of our materials, so that's what we're using at the base. And we prioritize that at the street condition where people are really walking right next to the building. And then up above, we have a lighter material, the composite metal panel, and that allows for ease of constructability and basically saves us a significant amount of money. And the money that we save through this logic then gets rolled in so the hospital can buy more equipment and accomplish more scope. Here's the way this looks when we add photorealistic rendering to that diagram. So here we're on that Lafayette pedestrian corridor. We're looking back at the podium, and you're seeing that more slender bed tower that rises up above it. That's the front door. And although the landscape architect isn't on board yet, we've begun to lay out a general idea for how this pedestrian corridor could feel with some benches and things that break that up and really create a sense of place as you move along that corridor. And then the garage is right over here on the other side of these trees. If we walk closer to the front door, we get to the next image. So here you see the entry canopy, 3 lanes of drop-off. You can see the detail that we're working into that brick podium. As I mentioned before, the larger vertically oriented glass windows, creating that civic scale against the streetscape, and then the bed tower rising up above that. The next image moves around to this side of the site. So essentially, we're looking at it from this direction and looking back at the main entry. You see the bed tower up above, that's in the composite metal panel, and then the podium down below. And we can walk closer to that entry canopy. So here you see the way the canopy works and the cars that we're covering. There's a lot of thinking right now going into how to ensure that we're protecting the people who are walking into the building from the elements, especially on the north face of the building. We know the weather is more severe over here, and this will almost always be in shade. So we need to be really smart about the way that we think about keeping ice off of the footpaths, keeping the cold air from coming in through a vestibule, and the design of the lobby in general. The elevators that go up into the tower are right behind this section of glass. So the glass here works as a marker for the front door, and a double height space then that creates a warm sense of welcome when you move in from the canopy and basically into the building itself. Then as we continue to move around the building, here we're looking at it from the southeast, and the bridge that you're seeing here in the plan is right here crossing Columbia Street. So basically that bridge is tying the utility building over here into the podium of our building. You can see the brick, that screen wall that goes around the drop-off area for the trucks, and then the bed tower rising above. And with every aspect of the building, not just its zoning and its materiality, we're continuing to overlay the knowledge from the historical buildings in Utica. So here's another example of that. Going back to Hotel Utica, it was more than just a base and a top. There was this move along the edge here that was really interesting to us. We were calling that the stitch. And it basically is tying the top and the bottom together and creating this really well-integrated building so that the top and bottom don't feel like they have an alien relationship. And that is how we designed all of the end walls on this building. So in this case, this move along the outside adds visual interest to the end wall, breaks up the scale of it, and then it also is pulling the copper color in this metal panel and tying that into the warmth of the brick. So really, in terms of color, these feel like they're a family, and it's pulling that warm color from the base up into the tower itself and working to make the two pieces feel interlocked and well integrated rather than having an alien relationship. Then we can pull back and we can talk about what it's like to be on the arterial and be approaching this building in relationship to the skyline. So you have the Odd over here for a reference point. This is our project site, and here's the Kennedy Plaza. And if we overlay our project rendering into this same skyline, you can see the Odd over here, a couple of the buildings from downtown Utica, our project, and then Kennedy Plaza. And essentially at 150 feet, we're the same height as Kennedy Plaza, so the building's working to be complementary to the tallest buildings in town and not overshadow them. We really think that it's important to think about the message that this building sends to the hundreds of thousands of people who are driving by on that freeway. It's important that the building ties into downtown, but it also has a responsibility to project all the good things that the hospital is doing and all the good things that are happening in Utica to the people who are driving by. And this view is a nice example of how that's working to be accomplished. And then the last thing we'll say about the exterior goes back to this fundamental diagram, the fact that we have old and new happening simultaneously in Utica. But what's also important with this is the space between those two zones and the amazing Mohawk River Valley and the nature that's in that band. So how can we borrow from that as an important driver for the site and think about the way that that could be applied to the design of our project? And essentially, we take from that these 4 bullets. We want to carefully consider the way lighting, security, parking, and pedestrian walkways work. We want to design the whole campus for walkability. We want to think about the views from the patient tower, so basically looking toward the north and seeing the hills, and looking toward the south and seeing the skyline, and never patient rooms that look into other patient rooms. And then lastly, incorporating park-like areas, tree-lined walks, and green infrastructure into the project. And that is shown best in this view, where we're again on that Lafayette corridor. We've elevated the camera a little bit so you can really get an understanding of the sense of place that we're creating here. You have the garage on this side, the tree-lined walk, and then our building. And it's been really interesting, even in the last week, to be meeting with other people in the community and talking about all the potential for the way that this public space could begin to be programmed so that people aren't just walking along a sidewalk. But as we met with the arts group, we talked about sculpture or other art that could begin to inform this experience. Or we could think about it in terms of a history walk that would have plaques that are about the history of the site, including the fact that the canal used to come right through the site on Oriskany. Or it could have a wellness component, and you could talk about how many steps you've accomplished if you've walked from one end to the other. Or kids' playground equipment, or other kinds of fitness programs that could begin to inform that design. And perhaps it's a combination of all 3. But we do think it has a tremendous amount of potential in terms of that park-like setting, and then borrowing from the site nearby. So with that, we wrap up the presentation. It's an overview of the way the building works, how it's situated on the site, and then how about all of that future and history of Utica is translated into this exterior character.